Hello, I'm Julie and I'm an exercise physiologist at Southern Cross Care. We are collaborating with the Country Primary Health Network, an initiative to help you achieve better health outcomes and be better for life. This video series gives you an overview on what chronic diseases are, how they affect people as they get older, and what health services are available to help. Please note that these videos are for your general reference only and should not be interpreted as specific medical advice. What is a chronic health condition? A chronic health condition is defined as any physical or mental health condition that has been present for 3 months or longer. 1 in 2 Australians have a chronic health condition and 1 in 5 Australians have 2 or more chronic conditions. They include things like high blood pressure, diabetes, lung diseases, cancer, and mental health conditions, including chronic anxiety and depression. Research shows chronic health conditions are among leading causes of death and poorer quality of life in adult Australians. Lifestyle factors play a significant role in a person developing 1 or more of these health conditions as they get older. It's important to note that chronic health conditions are not necessarily a normal part of aging. Studies find these conditions are often linked with lifestyle factors, such as diet and alcohol intake, physical activity, smoking, and stress levels. In recent decades, people are developing certain types of chronic conditions, such as type 2 diabetes and high blood pressure at a younger age, and therefore are managing these conditions for a longer period of time. For example, getting diagnosed with high blood pressure at 30 potentially means managing it for a longer time, like taking medication, and if it doesn't improve, taking even more medication, compared to a person getting diagnosed with high blood pressure at 80 years of age. As you can imagine, this can take a toll on your body over time. Having 1 or more chronic conditions can negatively impact a person's strength, fitness, mobility, and cognition. We collectively refer to these areas of physical and mental wellness as a person's functional capacity, a measure of how well a person can perform necessary and desired day-to-day tasks independently. In everyday terms, a person with a high functional capacity is able to do things like get dressed and shower without assistance, perform chores around the house safely, and walk without a walking aid. Compare this to low functional capacity. This is someone who is reliant on assistance to move, for example with a walker or wheelchair, and needs assistance showering, dressing, and going to the toilet. Healthy adults reach their potential peak functional capacity in their 20s to 30s. This is shown in the first section of the graph, meaning that this is when we peak in muscle strength, fitness, and cognition. As you start to reach middle age, our potential peak declines, either rapidly or slowly, largely depending on our lifestyle choices and health status. Adults who make healthy lifestyle choices have a better chance of preventing or delaying the onset of chronic health conditions such as high blood pressure and their negative effects on the body, thus helping preserve a higher functional capacity into later adulthood. As mentioned before, an adult who develops high blood pressure or diabetes in their 30s or 40s has to live with the negative health effects of these conditions for a much longer time than someone who acquires these conditions in their 70s or 80s, and if left unmanaged, will likely decline in their functional capacity earlier in life and be at risk of disability at an earlier age. Evidence shows that having a dedicated team of healthcare professionals who support and provide tailored treatment pathways to you leads to better health outcomes. There are a range of health and medical professionals who can help you better manage your chronic diseases. Some of these include your GP and specialists, nurses, pharmacists, physiotherapists, occupational therapists, and psychologists. We have created a series of health videos to assist you with supporting your health. We have selected the following disciplines: physiotherapists who can assess and treat a variety of muscle and joint conditions to improve pain and function, dietitians who can assist with everyday and specialised eating plans and advice, occupational therapists who can be diverse, but in the context of working with older adults, they can assist with home assessments, prescribing home modifications such as rails and ramps, and aids such as pickup sticks. Nurses who can provide care and education surrounding pain management, medication administration, and wound care. And social workers who help identify needs and provide practical and emotional support such as counselling, advice, and guidance. It is important to note that healthcare professionals undergo regular case conferencing and collaborate with you and your health team to ensure best possible health outcomes. So here are some key take-home messages. Aging is a continuous and natural process of life. You can engage in healthy habits to delay disability in later life and improve outcomes of your current conditions. Engaging with a health team can help you manage your conditions better. And if you're not sure where to start by having a chat with your GP.